Avoid unnecessary medical diagnostics. This is becoming a bigger and bigger problem in USA particularly. It's expected that the amount of people who have cancer because of their medical diagnostics is going to rise to 3% if the current trend continues. In UK, it's only 0.5% of all cancer attributed to medical diagnostics, and so that's a big difference between the two countries. And it's because in US, the per capita radiation exposure is more than double. Per capita CT scans, 3 times less than the UK. Nuclear medicine tests, 30 times less frequent. All right, so these numbers are directly correlated with the increase in risk of US citizens for cancer due to the medical diagnostic X-ray. And in UK, there's some chance, but it's less because there's less exposure. All right, so another thing that UK has done well, I think, that we can all learn from is that the protocols for optimizing exposure are good. For example, children get lower doses, and there's also protocols to minimize the amount of organ exposure. Not to mention newer methods that also can use less X-rays on any unnecessary organs. It's important to understand that childhood exposure is the biggest problem. Children are particularly sensitive in their red bone marrow, thyroid, breast, and brain. They're radiosensitive. Women are also more radiosensitive than men. The relative risk is 66% more for women to have a problem. And so limit medical diagnostics. Health professionals should recommend that people avoid physical and carcinogenic factors, recommend people limit diagnostic exposures to cases where decision-making depends on the test, right? So for example, I broke my leg and I had to decide whether to get surgery or not. And so I am getting that X-ray, even though I'm aware about the link between cancer and X-rays. Next, if the dose can be kept low as possible, that would be ideal. UV exposure remains a problem. Many people, especially the young, the fair-skinned, they're particularly at risk. People that work outside, that's considered a work hazard, to be out in the sun all day. What people don't know, they're not aware that the SPF 50 only prevents 98%. All right, that means 2% is still getting through. 2% is getting through your SPF 50 lotion, and that's assuming you put it on, and that's assuming it didn't get rubbed off. All right, and actually researchers recommend it be reapplied every 2 hours. For example, Lucas and colleagues, and they point out that 1% of UV rays are still getting through, even in SPF 100. Now, next, those high SPF brands, they're very thick. They're not very cosmetic, and so people tend not to put it on properly, okay? So they're not actually getting the coverage they expected. There's another interesting thing that people are not aware of. The sunshine can be dispersed by clouds. All right, so UV is not just from directly overhead, and one problem with ball caps particularly is that there's still plenty of exposure from this scattered, diffuse UV radiation. The point is that people need to understand that time in the sun needs to be limited. There's a healthy amount, of course, provides vitamin D, but it should be limited to what's necessary. Try to avoid peak, heat. Radon is a colorless, odorless, radioactive gas. It's the second leading cause of cancer. It's emitted from soil and building materials. It's important that people monitor and mitigate radon exposure through proper ventilation. And there are also detection methods. The carbon method is low cost. Radon alpha track detector benefit is that it can be reused. Okay, other physical exposures include particulate matter, leather, silica, wood dust. So these things, they're also produced in industries, glass, metal, pesticide industries, particularly the metal industries, dyes, pigments, wood, furniture industries. So these particles are in the air, okay? Again, that could contribute to lung cancer, nasal, stomach, even skin or eye. All right, so wherever those particles are entering. Next, EMFs. EMF exposure. Some people, they don't believe that EMF exposure is such a big problem. And there was a recent study that showed that under usual conditions, cell phones and these exposures are not a problem. All right, that's what's reported under usual conditions. But usual conditions means not using it very much, not holding it so close to your head. In that same study that they said we don't find any connection, actually they did find 5% increase in relative risk for glioma for simply using at least 1 minute of cell phone a week. 12% increase risk for glioma for 20 minutes or more a week. 14% risk of glioblastoma for simply 1 minute a week. 22% increase for glioblastoma for 10 or more years of use. 17% risk of glioma on the right side where people usually hold their phone, whereas there was no increase for left. 23% increase in glioblastoma for right side glioblastoma, whereas there was no increase for left. 22% increase for acoustic neuroma. And these data, by the way, they were not presented in the main paper, they were in the supplementary data materials. So news reporters, they're not even reading this. 22% increase for acoustic neuroma for daily cell phone use. 39% increased risk for acoustic neuroma for 5 to 9 years of cell phone use. And so there is a clear link between cell phone use and cancer. As far as mechanisms, there are established mechanisms. Some people say that it's not clear what the mechanism is. Okay, we can always search for more clarity, but there is an established mechanism. For example, ELF fields and the body is through electric current. All right, and we know that all our cells, well, not everyone knows, but our cells are connected through electric currents, especially our nerves. At least most people should know about this, the connection between the nerve system. This is one way cells communicate. Okay, next, mobile phones. The energy is absorbed to a depth of a few centimeters within the head. All right, so energy is released. Electrical energy, heat energy, it's microwave technology. Microwaves cook things, we know. And again, children are particularly sensitive. So that study I just mentioned was by Schutz, that recent study in 2022. 2013, Hardell's group, they found relative risk of malignant brain tumors 8-fold, 800%, 700% increase in relative risk of brain tumors for cumulative use 2,376 hours. So this is not a small amount. This means over years, over weeks, over days, lots of use of cell phone, 800% risk of malignant brain tumors. Okay, the Interphone study, the numbers were lower, but they were also looking at a lower amount. Interphone was looking at 1,640 hours of cumulative use. They also found increased risk of glioma, 40% increased risk of glioma, meningioma, 15% increased risk, and acoustic neuroma, the one I just mentioned, 32% increased risk. Okay, Han et al. 2012 found a 29% increased risk for acoustic neuroma for using cell phone for at least 10 years. Peterson and colleagues, 40% increase in acoustic neuroma for 5 to 9 years of use. Corot and colleagues, 45% increase in risk in glioma for at least 5 years of phone use. All right, so caution is advised. Okay, we're not saying we know that the link is strong, and we're not saying that you're likely to get a cancer, but it's possible. And we're supposed to encourage people to play it safe.